Hello, everybody. I hope you're all keeping well today. Today, I welcome back Dr. Platt to the podcast for another fascinating conversation. For those of you that
Okay.
don't know Dr. Platt, which you would be insane not to, Dr. Platt is a board certified internist medicine doctor, and he's recognized for his expertise in natural hormone replacement therapy and holistic wellness. He's the author of Adrenaline Dominance and the Miracle of Bioidentical Hormones. Dr. Platt has specialized in treating conditions related to hormone imbalances and preventative medicine. He has devoted the majority of his career to a wellness, holistic, and preventative approach to medicine and treating his patients. And his specialty lies in natural and bioidentical hormone replacement therapy. Dr. Platt, welcome back to the podcast.
Yeah, hi there. Good to be back.
Thank you for making time for me. So, I reached out to you a few weeks ago and invited you back on because all of a sudden we had the announcement of the removal of the black label warning on estrogen, and I caught a lot of my colleagues and myself kind of off guard. And I know you've always utilized estrogen in your practice, specifically estriol, but you're not a huge fan of estradiol. So, with the removal of this warning, and I'll add that the WHO and the CDC still have estrogen categorized as a carcinogen on their websites. They haven't changed that yet, but the FDA found it smart to remove the black label warning. So, why do you think they removed it now, and why do you think it was originally put on estrogen?
Well, there was pressure put on the FDA to get the cancer warning off because they felt women needed estrogen. And, when it comes to hormones, estrogen is my least favorite hormone. And when I use the word estrogen, I'm talking about estradiol
Mm,
um, because there are safe estrogens. And that's what I think women should concentrate on are the safe estrogens. Um, the but when women talk about problems related to their breasts, whether it's cancer or fibrocystic disease, whatever, or they talk about cramps or PMS or um, they talk about estrogen, and to me, it's just basically a toxic hormone. Um, the, um, the nice thing about estriol, which is a safe estrogen, but it's the only estrogen that's good for vaginal dryness.
hmm
And so it's something that women should be aware of. Um, so anyway, so I'm not sure why they took away that, that label warning. Um, they didn't discuss it with me.
Do you
Uh,
think there was a push maybe from Big Pharma to get it removed so that we more women would trust estrogen? Like, hey, if Big Pharma says it's okay and the FDA says it's okay, it must be okay.
well, it could be that they're putting some faith in another hormone called progesterone. And progesterone is actually a very safe hormone, and it actually prevents estrogen from causing cancer. So it could be that their thinking is that women can have estrogen as long as they're using progesterone at the same time. But
Mm.
I don't see that anywhere.
Yeah, I
I
don't
think,
think that's the case because a lot of these bigger name doctors, and you probably don't see them anymore, but all they seem to talk about is estrogen all the time. They never mention progesterone, even though the voices like my own and Carol's and a few others have gotten a little bit louder. These bigger names with all the money behind them still do not discuss progesterone.
well, you know, what people should be aware of is that doctors actually don't receive training in hormone therapy, even though hormones control everything in the body. I mean, they're pretty important.
Hmm.
So, and doctors are not trained to treat the cause of illness. So there's two things that doctors are lacking. You know, you know. So people have to understand that they can't look at their doctors as being know-it-alls. Um, the interesting thing is that gynecologists probably have the least knowledge about hormones of all
Yeah.
doctors. So um, it's sort of like not a perfect world.
Hmm. Gynecologists are the ones we're told to trust and go to see when we have our
Well,
female issues.
yeah. Well, I don't recommend that, but I know they do.
So what do you think, because you've always been an advocate of estriol or estriol, whatever way you want to pronounce it,
Hmm.
what do you think the biggest misunderstandings are now between that and the generically used estradiol, H or T? Because they're not the same.
No, they're completely different hormones. Um, oops, that'll stop. Um, the Yeah, there are three different estrogen hormones. There's estradiol, there's estrone, and there's
Mhm.
estriol. I recommend estriol. It's the weakest of all the estrogens, and it's the safest one. And it's as I mentioned before, it's the only one that's good for vaginal dryness. Um, so, so if women feel the need to have estrogen, that's the one I would recommend.
And am I
Um,
correct in saying that estriol is the one that's more in abundance in younger women, and that's why we don't see a prevalence of breast cancer in younger women?
that that I'm not sure about.
That's
Um,
something I heard Dr. David Rosensweet discuss a few times, and that's why estriol is the more protective of the estrogens.
okay, I'll accept that.
So then when you're recommending estrogen use to your patients or back in the day, what were your considerations? What were the symptoms you were looking for that would have you say, okay, we're going to try some estriol?
Well, you know, I think that what needs to be done is for people to have an understanding that hormones change, and women in their 20s and 30s and maybe even their 40s may not even need estrogen.
Hmm.
Um, the But when women start approaching what they call the menopause, then that's definitely a time that they can add, if they want to, they can add estrogen, um, which will help with some of their symptoms of going through the menopause.
Okay.
Yeah.
So what are these symptoms? We're looking at vaginal dryness, tissue regression, painful intercourse, aches, pains, brain fog, that sort of thing.
That's pretty good list.
Well, I
Yeah,
learned
I'll
from the
accept that.
best. So,
Yeah.
now, have you seen a direct connection to estrogen and anxiety and estrogen increasing adrenaline?
Um, well, that estrogen really doesn't increase adrenaline, um, and it does nothing. And estrogen is not helpful for anxiety. I'm a great believer in treating the underlying reason why people are not well.
Hmm.
So when it comes to anxiety, it's real simple because there's basically only one thing that causes anxiety, That's too much adrenaline. So when it comes to adrenaline, now we're talking about a different hormone to treat that, and that's where progesterone comes in because it blocks adrenaline. Um, so the but anxiety is, even in dogs they have something called separation anxiety, and that's also adrenaline, and it's also treated with progesterone.
Hmm.
If people have a and the progesterone cream goes into the dog's ear, and within about 30 seconds it'll take away the anxiety.
So we can confidently say that anxiety is caused by adrenaline in like all mammals, shall we say. I recently spoke to you about one of my clients who had a baby 3 weeks ago, and we were discussing that the baby wouldn't settle. And you had recommended that we could try some of the cream on the baby, and it did work. And it makes me think that a lot of this high adrenaline slash anxiety is familial and it's getting passed from mother to baby in the womb. And then these babies come out with higher levels of adrenaline. And like we see, they won't settle and they're fussy and they're clingy and all that.
I love your accent. Anyway, um, the thing is that if if somebody has increased adrenaline, that means that one or both parents have increased adrenaline. It is genetic.
Yeah, that's what I
Um,
thought.
the and the other thing is is that when women are pregnant and they feel the baby kicking a lot, that's adrenaline also. And these babies, when they're born or delivered, will probably have colic when they're so colic is caused by increased adrenaline.
Hmm.
Um, so now, is it safe to give to babies? Well, when they're in the womb, they get exposed to incredibly high levels of progesterone,
Hmm.
and so it's a very safe hormone to give to babies, and it will take away their colic. They just have to rub it on the baby's belly,
Hmm.
and it should go away very quickly.
If I'm correct, our mutual friend Carol Peterson said recently that in the womb, the baby gets exposed to 19 times more progesterone than we have in our most fertile years, which is extremely high.
I'll go along with that.
So that's one of the reasoning because with all the conversation around hormones and of course the Women's Health Initiative and everything, there is still a lot of women who are afraid to use hormones and even progesterone. And I'll say to them time and time again, like progesterone is our safest hormone. And if a baby, a fetus, is exposed to these massive levels, then you using 50 to 100 milligrams a day is going to be pretty safe.
Be very safe. The you know, I it's important that people remember that doctors don't get a lot of training in hormones.
Hmm.
So let's say that you have one of your people that are listening to this podcast and they decide to get some progesterone. Well, they could actually get it over the counter. But let's say they decide to go to their doctor to get a prescription. Well, I could almost guarantee that the doctor will prescribe oral progesterone because that's all they prescribe.
Hmm.
And oral progesterone is not the same thing as progesterone cream. So they're better off trying to get the progesterone themselves rather than to rely on a doctor that will give them the wrong progesterone.
Hmm. I have some clients, the majority of my clients feel better when they use the cream because, as I explain it to them, it's not passing through the liver. It's the majority of it's not majority, well, there's no percentage of it that's really getting converted to allopregnanolone. But I do have some clients who will mix and match because they need so much. They'll use some of the pills and then top it up with the cream in order to feel better because their symptoms are just so bad that they need a lot more.
Well, it depends on the strength of the cream that they're using. Um, progesterone, um, you they want to get a minimum of a 5% strength minimum, but it also comes in a 10% strength and a 7.5% strength. So anything from 5 and up are acceptable.
Mhm. Onas Naturals. I don't know if you've heard of them. They're based out of California too. They do a 20%.
Um, well, I wouldn't have an objection to that.
Yeah, but what I find is some women don't do well on it. For some women, it seems to be too stimulating all at once, and they do better with the lower doses a few times a day than one big dose.
That could be. I've never used a 20% strength,
Mhm.
so I can't comment on it.
So anxiety for me with my followers and the women I speak to, and even men and children, like it's everywhere. Anxiety is everywhere. It's one of the most common complaints, especially after COVID. From your perspective, do you think anxiety is more hormone driven than something psychological?
Yes, absolutely. It,
And this would
it,
also, would you throw ADHD into this category as well?
ADHD is only caused by excess adrenaline. So
And
yes, I
this,
would.
yeah, this is what I've been saying to people because the ADHD diagnosis in Canada is out of control. Everybody's getting it. And I'm like, no, this is high adrenaline. And we shouldn't be giving people these labels because people end up becoming their label or their diagnosis. So,
Well, um, to me, ADHD is not a bad thing. You just have to understand what it is, and basically what it is, it's excess adrenaline. So, and when it comes to adrenaline, it all depends on how much you have adrenaline and what it's affecting. But it's an easy thing to control because you can control adrenaline, which means you can control ADHD. Um,
there's a
so
disconnect there because the symptoms of ADHD, that feeling wired, I can't focus, overwhelmed, kind of, that squirrel mentality. You're in the middle of one job and then you jump to the next. All that, like, really is, most people will complain that they can't focus. And
right,
those are the same symptoms of high adrenaline.
right. I mean that's ADHD, a lot, a lot of adrenaline. Um, but if they have problems focusing and whatever, within 24 hours they can get a significant drop in their adrenaline um, if they choose to.
Yeah, if they use some progesterone, which is why we're having this conversation to encourage people that it's not something you should be afraid of. We should probably be a bit more apprehensive on the estrogen and why that's being pushed lately. So, one thing you taught me in my training was to look at AM cortisol specifically for adrenaline. Can you explain that?
I can, I can. Um, the adrenaline is the stress hormone. Cortisol is the stress hormone. And when people have a lot of adrenaline, they very often put out a lot of cortisol to deal with the stress.
Hmm.
What's interesting is that adrenaline peaks at 2:30 in the morning, and a lot of people wake up at that time to urinate because, adrenaline gives people that urge to urinate. Um, when you hear about women that have an overactive bladder, that's adrenaline. Now, anytime I mention a condition caused by excess adrenaline, it's fixable, you know, or treatable. Um, so, and it puts people in charge. People don't realize that it's just a matter of treating the cause of the problem.
Mhm.
So when it comes to adrenaline, you want to treat the reason why the body is putting out adrenaline. And, people know it as the fight or flight hormone. And it is. When people are in danger, the body pours out adrenaline. But that's a very rare reason why the body puts out a lot of adrenaline.
Mhm.
Um, the main function of adrenaline, the reason why people put out adrenaline all the time, is to raise sugar levels for the brain. Now, when it comes to ADHD, the people have to understand that the reason why they have ADHD or a lot of adrenaline is because the body is using adrenaline to raise sugar levels for the brain.
Mhm.
So if you think about it, again, if you give the brain the fuel that it needs, then the body doesn't have to use adrenaline to
Mhm.
raise sugar levels. People can do that by giving the brain the right fuel, when they eat. Um, so, yeah, so ADHD is not a bad thing to have. It gets bad because they use drugs for it, and that's
Yeah.
not necessary.
So if we if we're testing AM cortisol,
Right.
can that be, I suppose, a test for ADHD that we could say, hey, your AM cortisol is higher than we'd like it to be. That tells us your adrenaline is high, and maybe you don't actually have ADHD, you've just got really high adrenaline.
Well, if they have really high adrenaline, they have ADHD.
Yeah, so it's
Uh,
not the ADHD diagnosis though, but we could use the AM cortisol test for that.
yeah, what people, especially women, because they're concerned about weight a lot.
Mhm.
Did you know that women sometimes
No, I had no
concerned about
idea.
weight? And um, okay, the thing about adrenaline, keep in mind that the reason why the body is uh, releasing adrenaline is to raise sugar levels for the brain.
Hmm.
Now, when it comes to sugar, it doesn't matter whether you're eating sugar or if the body is making sugar. Um, Sugar increases weight. So, and remember, I mentioned that at 2:30 in the morning is when it peaks.
Hmm.
Now, when the body puts out adrenaline, remember it's a stress hormone. So the body responds to stress by putting out cortisol. Remember that's a stress hormone. Okay. And the first thing cortisol does, it raises sugar levels. So when people are sleeping, they're putting out two hormones that raise sugar. And it's probably the number one cause of weight gain, and nobody ever talks about it.
So stress
So,
response. Yeah.
well, um, yeah. So it's important for people to have an understanding of adrenaline and what it does and how to treat it. That's why I wrote the book Adrenaline Dominance.
Mhm.
Um, it goes over a lot of the conditions um, caused by excess adrenaline. Things like road rage. You can get rid of road rage in 24 hours. Um, the
The
bipolar
symptoms of
disorder.
perimenopause. That's all
Yes.
high adrenaline, low progesterone.
Yeah. Um, so the thing about AM cortisol, again, it's a stress hormone. Um, Now, um, when people are doing hormone testing, a lot of people do saliva testing. Now, the problem with saliva testing is that adrenaline prevents the release of hormones from the salivary glands. Um, so when they do, very often when they do a saliva test, they get a low cortisol level. And the reason why it's low is because the body is preventing the release of hormones
Hmm.
um, from, caused by adrenaline. So so they came up with a condition called um, the trying to think the adrenal insufficient adrenal
Adrenal insufficiency or adrenal fatigue, yeah.
okay, adrenal fatigue. Thank you. Don't ever get old. You start
I'm
forgetting things.
trying. I'm using lots of progesterone.
Um, yeah, so adrenal fatigue is a condition that doesn't exist. Um, and it's all based on interpreting saliva test incorrectly because they see a low cortisol and they think that's adrenal fatigue. Um, so I
But
just
if
want
you
to
were
let
to
you know.
test it in the blood, that AM cortisol will be really high, which is a reflection of high adrenaline, which really, for the adrenals to feel fatigued, it's just because you're running on adrenaline all the time and then you just get exhausted.
I'll go along with everything you say. Yes.
Well, again, I learned from the best. So you taught me that when we're looking at AM cortisol, generally we're looking for the number to be under 10 to be in a healthy range. And that's in US measurements. In Canadian measurements, I'm looking at under 275, I think it's nanomoles, that in order for us to perceive a woman's hormonal health first thing in the morning, I want it lower than that. But a lot of women I see are at least double it, which tells me that their stress response is really high upon waking, regardless of the dawn effect, regardless of like the natural cortisol spike, it's extreme.
Okay. Not easy being a woman.
You're telling me.
Yeah.
You throw in kids and a career and being a high achiever, it actually is not easy.
Yeah. Um, so I think um,
Did
so.
you
The thing
still
about it,
think that's reasonable to be looking for AM cortisol to be below 10, or have you changed your opinion on that?
no, I have not changed my opinion on that. Um, so, but remind your listeners that what you're talking about is the blood test, not the
Yeah, the
saliva
blood.
test.
Yeah.
Yeah,
Yeah, and in order for us to try get an accurate result, we're trying to get it drawn as early as possible. So a lot of the clinics here don't open till 7 a.m. So if you can get in around 7, 7:30, that's going to be as accurate as we can get it.
yeah, that'd be good.
What do you
Yeah,
think about prolactin as a test for high stress hormones?
I've never done it. I've never used it.
There's a lot of practitioners that I talk to that will use prolactin as an indicator of high estrogen and high stress hormones because the argument is that if there's very high estrogen, like estrogen dominance, I don't just mean like higher levels, I mean extreme levels of estrogen, we'll see that reflected in high prolactin.
That could be. I've never used that. So
Back to the adrenaline aspect, if somebody has chronically high adrenaline all the time and they never do anything about it, what are like the implications there? What does that do to the body over time?
well, they may have trouble sleeping. They'll be probably have insomnia. Um, they'll have anger issues, and I mentioned road rage before. Adrenaline is a very powerful hormone, So I don't recommend people live with high adrenaline levels because it's not healthy.
Hmm. If
Um,
it's making you insomniac, then there's going to be an effect on cognitive health over time, like instances of dementia and Parkinson's and all will increase if you're not sleeping properly.
that could be. That could very well be. The but adrenaline, like I said, it's an interesting hormone, and there are a lot of conditions that we haven't mentioned that are caused by excess adrenaline. When you see somebody sitting down and their knee is tapping up and down, that's adrenaline.
Fidgeting.
Um, and people should also understand that people that are creative have the most adrenaline.
Hmm.
And the reason for that is that the creative brain is a lot more active than a regular brain. And so the creative brain needs more fuel. And if people are not eating correctly, they're going to be just putting out a lot of adrenaline to raise the sugar levels for the brain. Um, so why don't we just mention a little bit about what people should be eating?
Yes.
Um, well, I mentioned, that the brain actually uses more sugar than any other tissue in the body. And anytime the body feels that the brain doesn't have enough sugar, simply puts out adrenaline.
Mhm.
So the best source of sugar for the brain actually comes from vegetables.
Mhm.
Vegetables break down into carbohydrates, which break down into sugar. So, so vegetables are the best source of sugar for the brain. Not the only source, but certainly the best source. Um, the other fuel the brain uses are ketones, and you can get ketones directly from something called coconut oil
Mhm.
or something called MCT oil, which comes from coconut oil. And so you could actually give the brain the two fuels that it needs, so it won't have to use as much adrenaline.
Mhm. Yeah.
So I guess and people, I don't know what it's like in Canada about getting progesterone. Um,
It's not fun, put it like that.
Not fun. Okay. Well, here in the U.S., they can get it over the counter.
Yeah, we can't get it
Um,
over the counter here. We
uh,
can we can order it online, but otherwise it has to be prescription.
um, my website carries progesterone cream,
Hmm.
and we do send to Canada. So
I
you should
know.
probably know.
What about just something that popped into my head as you were talking there? So we discussed like creative people, high adrenaline people, type though that would be type A personalities as well, highly driven people, I think. What about on the other side of the coin, these people that would seem to me to have very low adrenaline, they just can't be bothered with anything. They don't get stressed. They are not creative. They just want to sit around and watch TV and take life easy. Is that a problem? Like, is there such a thing as too low adrenaline where someone is just so carefree that, yeah, the adrenaline must be so low?
Well, it's an excellent question. Um, I've never approached adrenaline problems from that standpoint, um, and I probably should have. So um, I don't know what the effect of low adrenaline would be, um, but it might make people drowsy. Um, so it's possible that it, people
It's
low in adrenaline, they're
it's
sluggish.
not as common as the high adrenaline conversation. Like a lot more people have high, but it's definitely there. I obviously not as skilled as you are, but I would perceive these people to be just very low motivated and dare I say lazy because I can't think of a better word, but just very carefree, not go-getters, not creative, just easygoing, but not in a positive sense.
Yeah. Interesting.
Because I was speaking to a neuroscientist yesterday, and we were just having a conversation around dopamine and the dopamine hits, and I think we were talking about people who become almost emotionally numb, like they just don't feel any hormones whatsoever. Nothing phases them. They just kind of go through the motions of life, just kind of glide through life. And we were talking about maybe those would also be the people that we would be a bit concerned that they would be so emotionally numb that those would be the type of people that would maybe hurt others or hurt animals or something. And I wonder if there's a conversation around low adrenaline there as well.
It probably is. I've never had it, but but um, that that's very interesting. Um, it's almost like they're on drugs, like antidepressants and stuff.
Yeah, they're just
Um,
numb.
yeah.
I feel like Dr. Platt, we should have met like 30 years ago and I could have spurred on some
Oh,
of your research and work with all of my ideas and questions.
I didn't even know where I was 30 years ago. But anyway, yeah, yeah.
Well, I was only a child, so but everything happens for a reason. So we've discussed the common reasons on why someone might wake up with high cortisol or high adrenaline. What and we kind of associated that to the blood sugars as well. Then in the evening, so going to bed with high adrenaline, that's going to affect our sleep. And what else? Like issues falling asleep, a wired mind.
Well, people that grind their teeth, that's adrenaline. Getting up at night to urinate is very often adrenaline.
Hmm.
Um, there's something called restless leg syndrome. I don't know if you've heard of that. But again, where people find that they move their legs uncontrollably. And that's also adrenaline. And that's easy to fix with progesterone.
Hmm.
Um, the Yeah, so it certainly affects people's sleep, excess adrenaline.
Hmm.
Um, yeah, when people have a lot of adrenaline, they very often carry a lot of tension in the back of their neck. And that tension in the back of the neck can squeeze the um, one of the
It's the occipital nerve, isn't it? If I'm correct.
yes, yeah, and there's something called occipital neuritis, which causes severe headaches. Always mistaken for migraines.
Hmm.
Always, but easy to fix just with some progesterone on the back of the neck. Um, Progesterone causing the neck muscles tense can also cause tinnitus, ringing in the ears. So, um, so whatever. I'm just saying, adrenaline has a big effect on our lives.
Hmm. You mentioned grinding of the teeth. That would, because I see this a lot, that would include t what we call TMJ and the
Yeah.
clicking of the jaw when someone's jaw clicks or seizes where they can't open their jaw as wide as they usually would. But all of that then, that grinding will cause a headache too, along with the neck tension. So a lot of headaches here with adrenaline.
Yes, there are.
So
Um,
we can expect to see an improvement in all of this if we improve adrenaline. There may be a conversation around estrogen, but in your experience, like after all of your years treating people and in medicine, what is one kind of message that you wish women and even men understood about hormones and aging and conserving good health?
where does one begin? Um, well, it just people have to realize that um, they're in charge of their own health. and they can't rely on a medical system that has no interest in their being healthy. I hate to say that, but it's the way it is. Um, I know the United States, I'm not sure about Canada, but the United States is on the bottom of the list of healthcare of all civilized countries.
Mm-hmm. I know, I
So
saw that.
we're yeah, so we're number one, um, in a bad way.
Yeah.
So yeah, so people so people cannot rely on like I say, a medical system that's not interested in getting them better.
Yeah, you have to
So
take responsibility for your own health.
yeah,
Well, Dr. Platt, you're one of the last truth tellers out there. I
yeah.
wish there was more, but the way things are evolving, I don't know who's telling the truth anymore.
Well, at least you don't have Trump.
Well, at least I have you to guide me as well, so I could be a lot
Okay.
worse.
Yeah.
Well, thank you for your time today, Dr. Platt. It was a pleasure as always, and we'll stay in touch.
I'll be sitting by the phone. Okay.
Unfortunately for you, I have your phone number.
Okay.
Bye.
You take care. Adios.